We've got one of the best cardiologists in North America joining us now, Dr. Fahmi Farah. And, Doctor, it's always great to have you on the program. I want to welcome you back. How are you?
Always great to be on your show. Thank you.
Well, thank you. Appreciate it. Great to have you on board every Wednesday. And like we always do, you've got a lot of things that you're handling, like being the CEO of a major medical corporation, also being a surgeon, and one of the best in cardiology. Talk about that. Welcome back. What do you do?
Yes, I am an invasive cardiologist, also the CEO and founder of medical center called Bentley Heart. I'm also the director of Global Health Lines Foundation. So, yeah, quite a few things.
Oh, absolutely. It keeps us busy, no doubt. But that's a good thing. And you mentioned something. What was that global? What was that again?
Global Health Lines Foundation. It's a global platform where we work on multiple different things, actually, education for physicians and other providers, being a voice for global health, such as, raising awareness for heart disease, non-communicable diseases like infectious disease and things like that. We have a large platform on this, on women's rights and women empowerment, environmental conditions, economics. So there are various things we do on this platform. We've done a lot of work in India in terms of improving the healthcare system in general. Same thing with the UK. We have a pretty large presence in the UK and, of course, here in the United States.
Oh, that's marvelous. Outstanding. I didn't realize that. So the message of medicine, it's local, it's Main Street, but it's worldwide, right? The more info, the better on a global scale.
Absolutely. Absolutely. We are very much present on a global scale.
That's marvelous. And I would imagine what an exciting part of the medical field to be in is educating not only here, but overseas with other countries and giving people the empowerment to take charge when it comes to their own medical conditions. Thanks very much for joining me on the program. I was mentioning earlier, Dr. Jim was on earlier, talking about the importance of making sure that your pet is not overstressed when it comes to the heat. We're going to start to see temperatures go up and away, and you and I both in the Dallas area. We know that it's going to hit 100, and we won't see 99 until maybe October. So this does bring up some very interesting scenarios that if somebody is working outside, say a truck driver's got to get in and out of the cab on a continual basis, if they get overheated, what does that do to the heart muscle? How can that damage it?
Mm-hmm. So overheating can cause something called hyperthermia, and that can be dangerous for anybody, anything that's living, so not just pets, but babies, children, humans. And hyperthermia can cause heart attacks, can cause people to go into a different type of arrhythmia where the heart will beat in an erratic way and can cause a cardiac arrest, and it could actually be fatal.
Well, in a situation like that, what would be some of the recommendations to maybe avoid the hypothermia? Maybe wear light-colored clothing, short-sleeved shirts, shorts, things like that when working outdoors.
Yes, some of those things. Additionally, just minimizing your exposure when it gets dangerously hot in the summertime. Here in Texas, for example, during summer it reaches above 115 degrees Fahrenheit, which is very hot. And one other reason why we see a lot of people getting into trouble is leaving pets and children inside their cars. It's a dangerous thing. And, people, they have the misunderstanding that they can leave them there for just a few minutes. They're just going to run into the store and come back and they'll be okay. It is not, because it takes literally just a few minutes for an infant or a pet to get into that kind of dangerous hyperthermia and die.
Well, doctor, from that standpoint, say that a child is undergoing hypothermia. How do you treat that? I would imagine they've got maybe an accelerated heart rate, and with it being maybe a small child, that can be maybe twice or maybe 3 times as dangerous as maybe an adult, right?
Yes, because, infants, their reserves are very low, and it doesn't take much for their bodies to go into things like hyperthermia, and they just won't be able to handle it as well as an adult would. And some of the things would be, as we talked about, of course, avoiding situations like that. But if you do suspect that this baby or, anybody else is experiencing hyperthermia, the immediate thing to do would be to remove them from that heat and start cooling them down, like, wrap a cool blanket around them and call for help, call 911 and get that person to the emergency department as quickly as possible.
Doctor, one of the components of the trucking industry for the drivers is that they do a lot of warehousing work, going to a shipper, consignee, taking care of the responsibility of picking up items and then going on. And inside of those warehouses, it can get extremely hot due to the fact that the heat is going to be rising inside of that environment. If somebody's working in a warehouse setting, what do they need to do to stay cool and not run into danger?
I think hydration becomes very important. One of the reasons people get into trouble during extremes of heat, especially working like in a warehouse setting, is profuse sweating, and you just lose a lot of electrolytes along with fluid from your body. So making sure that you're staying well hydrated and taking breaks, make sure that you're giving your body the needed time of rest and to recuperate from those types of extreme situations.
And when you mentioned the importance of this whole thing of being well hydrated, would this mean simply just maybe water every now and then, or is it recommended maybe it's a benefit to the heart to have like something like Gatorade that's close by?
Yes, I would say water, of course, along with something with an electrolyte like Gatorade. Of course, it does need to be individualized based on the person's medical conditions, like diabetics, for example. They have to choose something that's not high on sugar. But yes, overall, we do recommend something like Gatorade with electrolytes.
Doctor, the emergency calls are going to be going out, say maybe a driver is at a truck stop and runs into overheating, or it could be on a residential street, in a home. What do paramedics normally do when they come upon a scene and they suspect there may be hypothermia going on? How is that treated in the field as compared to the ER?
In the field, the immediate thing would be just like removing that person from the overheated environment. So in paramedics, for example, they would put that person inside the ambulance where it's a cooled environment. And the next thing would be vital signs, to see basically giving them supportive care, making sure that, we start cooling them as quickly as possible by wrapping, cooling blankets around them just to get them to cool down, get the body to cool down. Whereas in the emergency department, they can do a lot more. They can give them IV hydration that are cooled so that the bodies can start cooling down faster from inside. So there are various things we can do, but overall for paramedics, the primary thing they're concerned with is, first of all, removing the patient from the scene and giving them supportive care.
And Doctor, the other side of that, with the paramedics being out in the field, no doubt they will be in the heat as well, tending to patients. What do they do as far as making sure there's no stressors on the heart as they are out in the field? Hydration, or there's some more that go along with that, with the paramedics?
Yes, they have to make sure that, first of all, they're healthy enough to do the job because, if you're going out there and running, lifting heavy things, it does require some amount of heavy lifting with patients. They have to be fit. They have to make sure that their heart health is under good conditions. The hydration, of course, eating healthy, exercising, taking care of themselves, seeing their physicians on a regular manner, making sure they're getting their routine checkups, that they are healthy themselves to be able to carry out the duty that they're responsible for.
All right, absolutely. It's interesting, Doctor, is that with all of the publications and material that is out there, that we still have cases of situations where the heart is overheated. The person needs to be taken onto the emergency room. We really can't take anything for granted as we get ready to go into summer here. very soon. Correct, Annette? Don't presume your heart is going to be able to withstand it. If there's any questions, check with your doctor, first and foremost, right?
Oh, absolutely. Yes. I suggest everybody to gear up for the heat that we're expecting and be sure to stay up to date with your routine checkups with your physician.
All right, we're good. All right, Doctor, let's do this. Going to take the short break. And drivers, love to get you on board. Dr. Fahmi Farah is on with us, one of North America's most recognizable names when it comes to cardiology. Are you heart healthy? Do you take one of those supplements for your heart? We're going to talk about that. When we come back in a few minutes, don't go anyplace. I'm Mark Willis. Phone lines are open. Dr. Farah not here to diagnose you over the phone, obviously, but to give you that information you need to take it on to your doctor and let them be your guide as to what you need to do. Back in a few. SiriusXM 147. You know, drivers, maybe it's me, but what I'm seeing more and more ads on television for these days are going to be for allergy medicines. You know, the Zyrtecs, the Claritins of the world, those ads are everywhere. You know, no doubt, really doing a lot of good for a lot of people out there. But, you know, it makes me wonder that with all of the pollen stuff going on and other allergies, what effect does that maybe have on the hearts or the cardiovascular system? Dr. Fahmi Farah is on board with us, one of North America's most recognizable names when it comes to cardiology wellness. And, Doctor, again, thank you very much. Every time I turn on the TV, it's, you know, Zyrtec this, Claritin that, which is fine. But I'm thinking, though, maybe the combination of a physical stress and a weakened immune system, can that lead to maybe the weakening of the heart muscle inflammation? In other words, the allergies maybe affect the cardiovascular system, which a lot of folks may not know.
So typically speaking, you know, allergy itself, like seasonal allergies, there's not really a direct correlation with that and cardiovascular disease. And same goes for the medications, things like over-the-counter things like Claritin, Zyrtec. Those are fairly safe to take even in those who have existing cardiovascular conditions. That being said, you know, inflammation in general is not a good thing, especially for cardiovascular health, because we know that inflammation is involved in triggering certain things like formation of plaque and igniting a heart attack. So whether, you know, like there's a direct correlation, we don't know that, but inflammation in general, yes, there is a correlation to that with your heart health.
Now, when you mention plaque, do most people who are not in the medical field, okay, plaque meaning plaque like something similar to what's on your teeth. Could that similar scenario develop with your heart, or is it a different kind of plaque?
It's a similar concept. It's actually a very similar concept. I'm glad you mentioned that. So, yes, it's just like, you know, with your teeth, like after you eat for a long time, you know, for some period of time, you kind of need to get your teeth clean, right, because you do get plaque built up. So it's a different kind of plaque, but it's plaque nonetheless. It's called atherosclerosis. It's a combination of materials like cholesterol, so those who have high cholesterol, and other markers like, you know, blood count products like platelets and other inflammatory markers that kind of combine together and create buildup that's kind of similar to what you just described. It looks like a plaque, except it's happening inside the coronary artery. That's the blood vessels that supply blood to the heart muscle. And the more plaque that builds up over time, the less blood that can flow. And when it reaches a critical value, the patient can become significantly symptomatic, like with chest pain, shortness of breath, especially with activities. And then the more plaque that builds up, that's also simultaneously increasing the risk of having a heart attack in that patient.
My goodness. And would the usual recommendations go out at that point? Say that somebody is diagnosed with that you send them home with the instruction of avoiding things like table salt or other kinds of, you know, maybe foods that might cause inflammation of the heart. Is it like almost a dietary thing as well that goes along with this on the go-home instructions?
Absolutely. Diet is one of the key things that determines your heart health. And when it comes to getting blockages and plaque built up, heart health, diet is one of the key components. So things that are high in sodium, like you said, high salt is not good for you. Things that are high in fatty products and high cholesterol, those are not good for you. So heart-healthy diet is very, very important to minimize your risks of forming these types of plaques and ultimately minimizing your risk of having a heart attack down the road.
Yeah, goodness sakes. And, if you maybe know the family history, maybe mom and dad has had cardiovascular problems, or grandma and grandpa had similar items going on. Two questions there. Can that be generational? And is that really important for the cardiologist to know the family history? And the other side of that, question 3, what if you don't know it? What if you don't know your family history? What do you do?
Family history is a very important factor when it comes to your, your risk of having heart disease. There's definitely a hereditary component when it comes to all types of cardiovascular conditions, and things like blockages are no different. So yes, for those people who have had known history or family history, they're at higher risk of having that, and so they should definitely pay attention to their other risk factors like high blood pressure, high cholesterol, diabetes, and they should seek help early on and get a heart checkup done by a cardiologist. That was, question number 1. And what was question number 2?
Oh, question number 2 is, say, what if you don't know? And are you at risk, say, if mom or dad or grandma or grandpa have got cardiology issues?
Right. Yes. So what if you don't know? That's I do get a lot of patients where they were either adopted or they're just estranged and they won't know their family history. And in those, we just have to go with their risk factors and a cardiac evaluation to see where they stand. But the important key message I want to give is that for those who have family history of heart disease, like, mom or dad or, first degree or second degree relatives, they are at higher risk of having heart disease, and they should get in to see a cardiologist sooner rather than later to get their risk assessment done and have that preventative care provided to them early on.
Doctor, I'll tell you a personal story that this was maybe about 7 or 8 years ago. I went in for a test to get some items checked on, and the physician sent me on to a genetic counselor. And the genetic counselor ran a series of tests, and that genetic counselor did great work. She comes back and says, Mark, you've got what is called P10, P-T-E-N, and it goes back probably 400 years. And it's like winning the medical lottery. It's like 1 out of 250,000 people get it. But with this condition that I've got called P10, I'm susceptible to things like cardiovascular disease, other kinds of cancers. And I've got to go in for routine checks, so maybe every 3-4 months or so, just to make sure that everything indeed is going fine, and it is. But when I hear things like P10 coming to the forefront, it was like learning a whole new world. When you find, doctor, that somebody's diagnosed, say, with maybe a disorder involving the heart, it's opening up a whole new world to them that they've got to take one step at a time, don't they, when they learn about that?
They do. And, it's so interesting to me what you just mentioned, the genetic testing. Technology is so advanced now. There's so much information people can find out. Of course, right now we're not recommending that everybody go get a genetic testing done. For the field of cardiovascular disease, at the moment, we do recommend genetic testing, but for certain specific conditions, if those exist in the family, for example, long QT syndrome, or there's something called Brugada. Those are more like electrical issues. There are specific things that we can do genetic testing for that we do recommend. If one person has it in the family, then sometimes we do recommend that the other family members get it done.
Yeah, absolutely. That's what the genetic counselor had mentioned, that everybody in the family get it done, and everybody did. And come to find out, my daughter's got the same thing. So she's battling the P10 issue, being 35. So again, it can strike, early. But the important thing is that drivers, if your doctor recommends getting testing for, fill in the blank, could be P10, it could be cardiovascular issues, things like that, get it done. That's the most important thing. And if you need to get help with heart wellness, cardiology, Dr. Fahmi Farah is the person to turn to. She's one of the best and most recognizable names in North America with this. And, Doctor, thank you very much for guiding us through this. Let's get all of the contact points out. Where can folks find you on the web, social media, and the phone number? Where can I go?
Thank you, Willis. It's always a pleasure to be on your show. You can find me at www.drfahmifarah.com, also on social media at Fahmi J. Farah on X and Instagram.
All right, very good. Doctor, thank you very much. I look forward to talking with you next week. That is Dr. Fahmi Farah.